In order to do ultrasound ESTIM combo, if you want to think of it as you've got a dispersive pad and an active electrode that's mobile and that shoots ultrasound as well. So it's a really nice modality. So to select it and set it up, you choose combo, wherever it is, on whether you're on a 709 or an 825. So you take this specific cord, it's two lengths, a short red and a long black. Channel 1. Get that seated in there. And then for the combo itself, you take the red pin. You notice it's a little different than the others. It goes in the side here where it says combo. And you gotta not force it, but make sure it's seated in there good. We had one last week or Wednesday that didn't quite get seated. So who's gonna be my first patient?
I can.
Okay, so I need your electrodes.
Oh, big one?
Sure, we'll do big ones. We're not gonna push that much current, but we'll err on the side of caution. So it's just one electrode, because the ultrasound head is the other.
Okay.
Okay. So get you set up on whatever we're gonna treat. Something on, let's do how about a shoulder? Mm-hmm. Actually, it's probably, you wanna be draped, you're being filmed. Okay.
Patient consent.
Patient consent and
We
it's
have
on film.
consent forms already from everyone.
Exactly. So, okay.
How do you want me positioned?
You can lie down if you'd like.
Sir?
Either.
There's pillows on both hands. It's confusing.
There, patient option then. Okay. So like all our other dispersive, are you going to be my therapist?
I can.
Okay. So set him up.
Okay.
I'm sorry.
Not a good start.
So dispersive, just out of the way. Doesn't matter, proximal, distal, whatever.
Shoulder.
Yours from down. These aren't here.
Okay, and our ultrasound gel over here somewhere. Where'd it go? Something is missing in here.
It's the same concept, Chris, like further apart there, like whenever you
Yeah.
treat is okay.
Yeah. No.
Go down here.
Yeah, so
Okay.
we'll treat up here. Ultrasound gel. Okay, thank you. All right. Yes. The other one will be our mobile electrode. Okay. So here comes the gel. Set up our patient. We'll just treat this area here. So go ahead and set him up with some gel.
It's gonna be cold, man.
You didn't warm it up for me?
I did.
It was not in a warmer.
Give it a shake.
It's like a ketchup bottle.
Yeah. Okay, you can be generous.
A little more.
We got plenty. Okay, so for the controls, you're gonna choose combo. Okay, so that automatically goes to ultrasound. So you're gonna set your intensity and all your other your settings for ultrasound. So 1 megahertz sounds good for this area. Continuous, we'll say you want heat. Okay, you don't have to move the head yet.
Right, it's just run the gel.
Yeah, there you go. Okay, so turn up the intensity
Okay.
to an appropriate level for 1 megahertz continuous ultrasound. Okay, that's good. Now you hit start, but with combo, it doesn't start the ultrasound until you set the ESTIM. So go ahead and hit start. Even if you're waving the ultrasound head around at this point, it doesn't matter.
Okay.
Now, you notice it changed from sound to premod. So with this, you can use premod, you can use biphasic, you can use Russian or high volt. So the default is premod, we'll just go with that. You have the same high-low settings, 0 to 10, 80 to 150 that you're familiar with. You can also, go down to alternating, consecutive, and fixed. So you can experiment with those
Okay.
once we get, and then on fixed you can do 4 to 10 maybe.
Okay.
Okay, so you just start turning up the intensity, and with patient feedback, they recommend the ESTIM stays low, so like 10 to 15 is what they recommend as the maximum intensity for ultrasound.
Doesn't it need to be on channel 2? That's what someone was saying last class.
feel anything yet?
So with the combo,
I'm starting to feel the ESTIM.
Okay, and your conductance is good. Getting some good pressure and contact.
So just up to the tolerance again?
When he says go, you hit start the second time and the treatment commences. The time will start ticking down and you will start
That's good right
the
there.
ultrasound.
Good there?
Mm-hmm.
Okay.
On the treatment.
No, it defaults
Don't stop.
over to this channel. There was some confusion with that the other day. Channel 1 is the active channels, you can see from the green.
The treatment time is
Feel interesting.
5 minutes.
You feel
Well,
electricity?
that's the default. I'd have to look at the lab tools,
Okay.
honestly, to see
So-
what the true testable time is.
That's Chris.
Okay.
With the ultrasound ESTIM combo, are we targeting like 2 different muscles at the same? Like,
No, you're just treating with ultrasound and the ESTIM.
Where do you feel it?
Is
On
the
the pad or
ultrasound like
the head too?
also?
Probably both.
Both, but two different
Is the ultrasound also doing like
The pulse.
pulsing?
Depends on how you set it up.
Oh.
Okay.
Like,
So
would
right
you
now
feel
he's
it
using
in-
Premod on a fixed at 4,000, right?
Right.
You could alter that. Take the intensity down and choose a different, change it to high. Mhm. This one you can change all that during treatment, and then you would go back up with the intensity
Yeah,
based
so-
on his feedback.
Just let me know.
For what?
Feel different?
Yeah, and you feel.
The ESTIM?
Mm-hmm. We switched from fixed
I'm
to
still bumping the
fixed at
intensity.
4,000 to high.
Feels.
You can see the.
There you go. Stop right there.
Yeah. Okay, so he's good. 15, that's about where they tell you should be the maximum.
So say we're doing this. So with the ESTIM, we
in
have it
control
there.
of you.
We're kind of doing an area away from it because it's
You
gonna
are.
the ESTIM's gonna like spread out, right?
As your, yes.
Okay, so then
If
say
I'm
we're
motor-
doing
And then remember your ultrasound treatment area should only be
Right.
twice the size of your ERA.
So say we're doing quad,
Like I'm focused
Okay.
on spreading the gel out.
like
You're on my opposite
dispersive
shoulder.
pad here.
Okay.
Would we just ultrasound like underneath it or like
Yeah,
above it?
and one of the cautions is not to touch the ultrasound head to the pad. You want to keep a distance between them.
Look at
But
that.
it's connecting, yeah, it's completing a circuit.
Okay.
Yeah. So further apart, it's also going to go deeper. He's also using 1 megahertz on his ultrasound, so that's going to go deeper as well. Now we can play around with some other things. Let's take the intensity down. Let's try combo with Russian.
Oh my gosh.
So you can just switch to Russian.